the best way to maybe talk about an idea that's been brought to fruition would be first to maybe talk a little bit about our organization and where we came from. And so, as you've probably noticed by Henry's accent, he's not from Canada. He's actually an American friend of ours who has flown in from Chicago for the day. And basically, the idea of the 53rd week actually started on the back of a napkin at a Costco in suburban Chicago back in 2009. Basically, as a medical student, Henry used to go down on what are called short-term medical trips to the Dominican Republic. And if any of you have actually done any work in global health, you know that that's kind of a dirty word in the global health community. There's a general movement in the end, one that we agree with, that in their current form, short-term trips are very unsustainable, probably not viable, maybe are doing more harm than they're worth. Our idea, though, was looking at it from the side of young people like ourselves who are interested in, who live in societies where we're interested in making a difference, which values things like charity and altruism, and but at the same time we're submitted to things like financial pressures. Not all of us have one lotto 649. We can't all go everywhere whenever we want to do whatever we want. Financial pressures, time pressures, familial pressures, all these other things. So what we notice is even though at present the global health community is saying, well, you know what, short-term medical trips in their current form are, as we say, a kind of placebo. The community feels good, we feel good, but nothing ever really changes. We believe, though, that they actually represent, first of all, immensely personal and passionate investments by young people who are trying to make a difference. And second of all, they represent potential in the idea that instead of ignoring them and saying they're useless, is there a way we can make them better? Is there things that we can do? So pretty much since Henry was going down to the Dominican Republic, he's been back down ever since, and then eventually I was helping him plan some stuff, and then he got me roped into it. And then each time we went down, we slowly discovered that there were other teams doing the exact same thing that we were. 30 other teams showing up with the same local partnership. And we said, wouldn't it be great if we took all of these individual investments and basically tried to get everyone to work together on more longer-term sustainable goals, longer-term sustainable projects, instead of just going down and handing out pills for a week and feeling good about ourselves. So that was where essentially the impetus of the 53rd week was born. So next slide. So essentially, our nonprofit organization is focused on improving the delivery and effectiveness of short-term volunteer trips. And rather than just saying, we should stop people going on them, whatever, we say, we recognize that short-term volunteer trips are going to happen because we live in societies that, that promote that volunteerism, that promote that interest. If they're going to happen, can we reduce the harms that are associated with them? Can we involve local partners? Can we actually improve the outcomes? And the ways we're doing that is essentially through research into the phenomenon, because surprisingly, if you do a PubMed search, you do a Medline search, there's very little research about short-term trips in terms of their outcomes. There's a lot of ethical discussions behind them, but the actual looking at short-term trips is quite limited in terms of literature. And then in terms of coordination resource allocation, so what I alluded to earlier, if we actually take a bunch of things, and hence the name of our week, in 1 week, there's very little you can accomplish in a community abroad. But if you take 52 weeks and you put them all together, could it be something that's bigger than the sum of its parts? Could it be, essentially the 53rd week exceeding what's the ordinary? And so right now, our collaborative model has essentially been piloted in the Dominican Republic, which is where we got our start. We developed a shared web platform between these 30 different teams. The goal was initially to provide primary care to Haitian refugee populations, but me being from a public health background, we've also been trying to push a bit further, just saying things like, training the trainers, increasing professional development, working for more sustainable solutions, working with the local partnership through this web platform so that people aren't just going in there and just sort of duplicating efforts and, and wasting resources that they're deeply